King Abdulaziz University, Faculty of Pharmacy. And today I'm going to talk about the pharmacist's role clarification. And I'm going to cover all those parts. We're going to define the clinical pharmacy. We're going to talk about the postgraduate opportunities, hospital setting, my shared experience of interprofessional education in King Faisal Specialist Hospital. So, when a lot of people think about the pharmacist, they think about that person who wears a white lab coat, sitting behind the counter in that pharmacy across that street, counting medication and selling them. Is that what the actual real pharmacist's job is? Because from my experience by getting my internship at King Faisal Hospital and getting my summer training in 2 different hospitals, what I do is a little bit different. Most of my job doesn't even involve dealing with medication, touching medication, or dispensing medication. I do more of a patient interview. I have a lot of patient interaction. And then I'm an advocate for the patient with the physician and the other healthcare provider that they may have, making sure the patient get and receive the best medication for their disease state. So if we're going to define the clinical pharmacy, it's a branch of a pharmacy in which the pharmacist provides the patient care that optimize the use of medication and promote health, wellness, and disease prevention. So as part of my job, we make sure the patient receive the best medication. And one of the ways to do that is by considering the patient from a holistic perspective, taking their preferences into consideration, and also what would be the best for them as a whole, and helping them to prevent the error, one of the biggest things that we do. We make and we get an accurate medication list, we give it to them, and they take it and give it to their healthcare providers and the physicians. Postgraduate opportunities. As we know, pharmacy is a huge word, and there's a lot of different things you can do, and so many areas you can work in. And here's some example of a practice area in pharmacy. I'm not going to talk about every single one of them, but I'm going to highlight some which I think most of you might not be familiar with. For example, chain drugstore pharmacists. Here the pharmacists counsel the patient and manage their health. We can see it a lot in the different Western countries. It's like a pharmacy inside the supermarket, so while you're shopping, you can get your medication too. It's like Target and Walgreens in the United States. Community pharmacist. Here, the pharmacist is working in a local drugstore. I think this one is the most familiar here in Saudi Arabia. Compounding pharmacist. Here, the pharmacist is responsible to prepare the medication in a different delivery forms. Critical care pharmacist. Here, the pharmacists go in a patient rounds in the intensive care unit with a multidisciplinary team of health professionals, aiming to optimize the use of medication in the sickest patient in the hospital. They can be specialized in so many areas. For example, he could be specialized in pediatrics, general surgery, cardiology, burns, trauma, etc. Nuclear pharmacist. Here, the pharmacist is responsible to prepare the radioactive materials. The nutritional support pharmacist. Here, the pharmacist is responsible for all the TPN inside the hospital, in collaborative, of course, with the dietitians. Oncology pharmacist. Here, the pharmacist has a crucial role in cancer patient who's treated with a chemotherapy and highly alert medications. Pharmacy benefit manager. He's responsible for adding the services that improve the quality of life. Regulatory pharmacist. Here, the pharmacist who can work in the FDA. And veterinary pharmacist who can deal with the sick and injured animals. Main roles in a hospital setting. Hospital simply couldn't function without a highly trained and highly skilled hospital pharmacist. Hospital pharmacists produce a personalized medication allowing for specific and individual treatment for every patient. They have face-to-face meeting with the patient to ensure they understand all the important aspects of the medication they are taking. They're responsible of the drug delivery, medication safety, patient education and advocacy, monitoring of a drug therapy. Hospital pharmacists also involved with cutting-edge clinical trials, treatment of cancer, emergency medicines, and treatment for all the right diseases, and many areas of health in the hospital setting. Of course, all of these by teaming with other healthcare providers. In short, hospital pharmacists make sure the patient get the right medicines for the right time, and of course, all of those administrated in the right way. They ensure that all hours of the day and night, patients in the hospital wards have the medicines they need. Now I'm going to talk about my experience of interprofessional education in King Faisal Specialist Hospital. The IPE program that I took last year really helped me to deal with my colleagues and to collaborate with other healthcare providers from other specialties. Working with doctors and nurses, the pharmacist helps to make sure the patient gets the right care and treatment by prescription medication, dispensing medication, counseling the patient, monitoring, and provide the pharmaceutical care. But I'm going to stop with the first point, which is prescribing, but with collaborative agreement. What does collaborative agreement mean? There is a misconception about what the pharmacist can do, and I wanted to clarify something. The doctor of pharmacy or the clinical pharmacy, he's not a physician. He's not the one responsible to diagnose the disease, but he's the one who's responsible to prescribe medication under collaborative with the physician that the patient has. And one of the examples to make the picture crystal clear is the anticoagulant clinic. This clinic I saw in King Faisal Specialist Hospital that I really like, and I enjoyed the experience over there. It's a clinic where the patient can follow his condition monthly, but not with the physician, with a pharmacist. Once the patient is diagnosed by his physician with any bleeding disorder, the hospital book for him a monthly appointment in this clinic so that he can follow his condition with the pharmacist. So here, the pharmacists play a vital role to make the patient adhere to his anticoagulant, for example, warfarin, and they make sure they take every single dose and check the INR and adjust the dose if it's needed. So hospital and hospital pharmacists, like everything in the modern world, do not stand still. Change is a constant. And the IPE program dedicated to ensure that all healthcare providers with all different specialties play its full part in the continuous improvement of treatment standards and achievement of a new level of success in terms of the patient outcomes. It also helps us to set out the future direction of their profession, how it can further serve the patient and enhance the collaboration with other healthcare professionals. As we always said, when I is replaced by we, even illness became wellness. Thank you all for listening. If anyone has any questions, feel free to ask, and I gladly answer.